services in Africa are being delivered alongside dramatic changes on the continent. Stronger economic growth, a growing youth population, and rising demand for good public services are reshaping the landscape for health. Some spectacular gains have been made. In 12 of 20 countries, child mortality is falling faster than the rate needed to meet the 2015 Millennium Development Goals target. And controlling river blindness in Africa has freed over 25 million hectares of arable land from the risk of disease. Yet, results have been uneven, with maternal mortality levels falling too slowly. This is also true of child malnutrition. Weak health outcomes affect people's lives and also hold countries back. After all, health is wealth. Interestingly, in East Asia, health improved before wealth. In China, child mortality and malnutrition fell most sharply between 1960 and 1980, before economic liberalization and rapid growth. With more children surviving, many African countries are getting closer to a demographic transition with booming working-age populations. While that's good news, fertility rates remain high in many countries. So the question is, will Africa reap a demographic dividend? Much depends on helping to sustain the demographic transition. For this, women need to be better nourished, receive skilled care during childbirth, and access family planning services if they wish to space their children. Girls' education is also critical. Africa's future productivity is also linked to childhood nutrition. Productivity gains or losses are locked in during a critical window, the first 1,000 days of a child's life. Promoting breastfeeding in the early months and giving vitamin supplements costs very little per child. But this can place children on a higher earning trajectory for life and ultimately raise GDP by 2 to 3% a year. Deworming also has far-reaching payoffs. In Kenya, it reduced absenteeism, gaining about a year of schooling for only $3.50 per child. Later, adults who had had school deworming worked more hours a week. They were also more likely to have better paid jobs. The return to investment was at 65%. Preventing and treating malaria remains critical. Estimates from Chad, Congo, and Rwanda suggest that with each malaria episode, a worker loses between $8 and $18 in productivity. With malaria testing and treatment, earnings for sugarcane workers in Nigeria increased by 26 percentage points. Recognizing that nutrition and health are sound investments, bold, locally devised financing and institutional reforms are underway in Africa. In Ethiopia, a vast network of over 35,000 trained health workers has been deployed in rural areas, visibly improving health services such as community-based nutrition. In Rwanda and Burundi, an approach called results-based financing that gives frontline health centers more autonomy and motivates health workers to perform better has helped to dramatically improve health results. This promising approach is now being piloted all over Africa.
Niwe nibarutse neza kuko sinarushe cyane bashyizemo intoki gusa banyakirira umwana niwe nabyaye neza kandi niko karusho nabonye.
More funding from domestic revenues will be needed to take these promising initiatives to scale. For example, Botswana has shown how revenues from natural resources can be harnessed for health. Innovative funding is also needed. In Lesotho, a public-private partnership has transformed healthcare in Greater Maseru, bringing vastly improved services to people. As Africa moves into top gear in terms of economic growth, smart, sustainable, large-scale investments in people's health and nutrition will help more people benefit from growth and drive the economies further forward.